Hello. Sorry I kind of zoomed in. You know, college campuses, you drive, you get lost. Well, hello. My talent is certainly not directions. I have other talents. So anyway, I'm going to tell you a little bit about PA. I did look up your what this program is, this biomedical science, and actually was pretty impressed with the breadth and the depth of science that you take, because I will honestly tell you, for PA school, you can't take enough science. Okay, you cannot take enough sciences, and take your 2,000, 3,000, 4,000 levels if you really want to get in, okay? I am from the State University of New York. Stony Brook University is where I graduated. 2001, I came down here just before they bombed my gorgeous city, and have been working as a PA for about 8 years, and then the opportunity came about 6 years ago to jump on board with Nova, and I jumped on board, and I have never regretted it ever since. I absolutely love it. Just got my doctorate in May, so that was really cool, walking across the stage. You'll feel so good. But I am a PA. I was a nurse for a long, long time, and had to sort of make a career choice. And, you know, your choices aren't always dictated by what you would like to do or time frames, and PA was quicker, much more painful than going to nursing school, but that was the path I chose. And I put this picture up here because here's Matt Lauer on the Today Show. October 6th, that whole week is National PA Day, and the PAs from Stony Brook, I was very proud, actually sat there on the plaza and made their presence known. So what is a PA? We are certified, state licensed, okay? You have to be licensed in whatever state you work at. You take a national certification exam. We practice with other healthcare professionals, mostly with physicians, okay? We are their right-hand man, all right? Our law says that we practice under the supervision of a doctor. The difference between an NP is they can be autonomous, okay? So if you really want autonomy, go that way, okay? PAs have to work side by side with an MD. It means I could be in another satellite unit, but he has to be there ready for me by phone if I have a problem, okay? You never lose the connection, and I love the teamwork in healthcare. That's what I love. So we do prescribe medications in all 50 states except for District of Columbia and all U.S. territories with the exception of Puerto Rico. There's a lot of new exciting legislation on the plate, and we'll get to that. So I was following the outline that I was given, and I kind of drew this up. The pros of the profession vastly outweigh the cons. I mean, it's like this. The pros are the collaboration. There is nothing like putting two heads together when it comes to taking care of patients. You bring what you have, you bring what you have, you bring the data you found, and we put it together. We make a perfect treatment plan. I love teaching patients. I love educating them. It's funny, I'm a Bruce Springsteen fan. Coming from New York makes sense, right? And he has this one song where he says he learned more from a 3-minute record than he ever learned in school. And I would agree with that, but I learned more from my patients than I learned from my parents. My career is longer than you guys are alive, so I can rightfully say that. We do have a good amount of autonomy despite the fact that we work under a supervising physician, because I can pretty much do what I want. When you first get out of school, you are qualified to go out there. You'll be hobbling your way around. You'll ask for help. No problem. That's what you do. But after a while, you get so comfortable and your physician trains you and you work with them that you become their right-hand man, that they'll just set you out and go. I know some PAs that work in cardiovascular surgery, family practice, they're autonomous. They pretty much go. Their physicians trust them, okay? So that is an exciting part, that you can work your way up to that. The education, our education totally aligns with that of physicians, which is why we kind of have the same mindset. Nursing goes off on a different path. The nursing path, the end product appears to be the same, but we follow in that medical model. And that's got good pros and cons, but that's what we do. The schooling is shorter. Most programs are anywhere between 2.5 years. It's intense. I thought nursing school was tough. This brought me to my knees. I used to beg my friends to shoot me. It was so intense and so hard and so short. You don't have time to stumble. You fall, brush your knees up, get up, and go again, because we just keep going. We don't stop. We have a lot to cram into your head into a small amount of time, because you've got to learn how to take care of patients. And the other thing that's really good about PA, you're not confined to one area of medicine. So when I came out, I ended up in spinal surgery. How I got there, that's where the openings were. So I learned my neuroanatomy really, really well. But after that, I went into family practice / occupational medicine. So I can do DOT physicals and all that kind of stuff. Then I went into pain management. Then I went back into family practice. I tried cardiology for a short time, and I went into GI, and I loved GI. And I stayed there about 2.5 years before I went to teach. I'm not going to say it's easy to switch. You have to train yourself. Your physicians train you. But it's not like getting out of med school and being a pediatrician, and that's what you do. Not like being a nurse practitioner where you work in neonatal ICU, and that's what you do, okay? I can switch. The cons, the shorter intensive schooling. I'm telling you, it's brutal. It's brutal. The hardest part of taking care of patients is realizing that they're all not going to do what you say to do. And it wears at you, and it wears you down, but you learn to deal with it. And you just keep going out there every day, and you do the best you can do. We have to recertify every 10 years now. It used to be every 6 years, but we're aligning, like I said, with the medical profession, and they recertify every 10 years. We are not board certified like a physician, although kinda, that's the same thing, but insurance doesn't recognize it as board certified. But in order to work, you've got to have the PA-C, the certification after your name. And I'll get into that in a little bit. Where do PAs work? Everywhere. Everywhere. You tell me a facility, you ask me a question, I'll tell you they work there. We're trying to get a little bit more into research facilities. We PAs are not really good at writing. We've got to get better at that. But we work everywhere, okay? So sky's the limit. Changes in the field, the recertifying requirements have gotten stricter for us like they have for physicians. That's sort of government-driven, okay? Era medicine-driven, okay? So I don't really see any faults with that because when you attain that, you've attained a certain level above the average, and that's a really good feeling, and your patients know it. The healthcare system has made a lot of changes. There's new coding coming out. We're trying to teach our students. Reimbursement is different. We're getting different models of medicine, such as the patient-centered medical homes, the accountable care organizations. You have electronic medical records, the goods and bads in that. There's a lot of things. I don't ever look at anything as bad. There's some bad stuff, and there's some good stuff, and you got to work your way through. And eventually you'll weed out the bad stuff, you'll modify it, and it'll all end up being pretty darn good. Nothing's perfect. So I don't have this horror thought in my head about the new health care. I think it's going to work. It's just going to take some time. What's going on in Florida is new PA legislation. We are, unfortunately, one of the only 2 states in the country that's not allowed to prescribe controlled substances. Having worked in pain management, I was kind of happy not to have to do that, but you got to stay with the times. So the Florida Academy of PAs is fighting for that. The bill is on the table now, and it looks like we're going to end up with that. Yes?
What is the difference between prescribing controlled substances in another state and in Florida?
Legislation by the states. Florida is a very conservative state. When I came here from New York, I literally thought I was in a backworld country. I could not believe what I couldn't do. But in the 10 years that I have been here, the Florida Academy of PAs, pay your dues, join and they do phenomenal things. We have great lobbyists, and they're fighting for this one, and I'm pretty sure they're going to be successful. Because Florida doesn't want to be one of 2 states that doesn't allow it. You know, it kind of looks bad, too. So, sure.
What's the advantage for you guys to be able to?
The nice thing is, instead of waiting for my physician who might not be on site, you know, maybe he's on vacation, I can't order those medications. The efficiency, absolutely. And I would have to have a DEA number and all that, kind of the headaches that go with it. But as far as helping patient care, it would move it along a lot quicker, okay? So the employment need for PAs is phenomenal. And I took these numbers. I actually spent a lot of time looking these up. We are going to be short 90,000 physicians by 2020. So hence the need for mid-levels, NPs, PAs. We need to fill that gap, okay? So I just wanted you to see that. I'm not making these numbers up. But you also got to remember that we're losing our physicians. They're retiring, okay, as they're getting older. A lot of younger people are not going into healthcare or into medicine because of the length and the cost. They really have to do something about the cost of med school to make it more attractive. One of the things that I do like is they're doing a lot of online courses now. And my whole doctorate was pretty much online, and I've transferred 2 of my courses to online. Can't do everything in PA online, but I can do a lot online. So if that's what gets you in there and gets you moving, I'm all for it because we need to fill the gap. Physicians are retiring, but at the same time, we've got people in phenomenal numbers turning 65 every day. So the numbers in doctors are going down and the population's going up. There's a big gap we have to fill, okay? Chronic disease is on the rise. You know, diabetes has quadrupled in 10, 20 years, you're never going to be out of a job as a PA, ever, ever, okay? The Patient Protection and Affordable Care Act, that's extending coverage. We don't have enough people to provide it, okay? And the other thing is they have been capping the number of residency slots since 1997. I don't know what they're thinking, that they don't allow those slots to be opened up. But at some point, something's going to have to give. You've got to allow doctors to have spots to go. So the physician shortage is there, but the bigger problem is the lack of PCPs, the primary care provider. That's your main doc, okay? The one that's supposed to be your gatekeeper, okay, with the old HMO system. That's where the biggest shortage is. The specialties were specialty heavy and general provider poor, okay? And that's where we're trying. I'm always trying to tell my students, go into primary care, primary care, primary care. We'll see. Specialties pay pretty well. You know, that's the reality. You come out of school with $120,000 worth of debt between your undergrad and your grad. I can't fault you for finding something that pays a lot of money, okay? But you can change, all right? The Bureau of Labor Statistics predicts that the physician assistant profession is going to grow by 38%. There's nothing but medicine, biomedicine, the STEM, science, technology, education, and medicine that are going to grow like that. So you'll never be without a job. Ever, never, never, I guarantee you. But the projected employment, as you can see, will be 120,000 PAs, and we have 100,000 now, okay? So do employers need us? Yeah, there have been multiple studies, because I've cited these all in my dissertation papers, about the cost effectiveness of PAs. Okay, we are so cost effective that a lot of the hospitals bring them in. In Orlando, you're not going to find a lot of PAs. They have hospitalists here. You go up to Jacksonville, jobs like crazy for PAs all over the place. Out in Tampa, jobs all over the place. This area is going to catch on. It's going to take a little bit longer. But we are expected to take on the role of the primary care provider. So if you come into your doctor and you have a cold, you should be seeing me as opposed to seeing him. He should be seeing the more sicker patients. And when you get so critical or so difficult for me to manage, like I would manage my diabetics till it got to the insulin point, then I would refer them to my supervising physician, and we would trade the patients and just work as a team, okay? So that's what I love about that, okay? That's what I love about being a PA. Nova Southeastern University itself, 9th largest not-for-profit, believe it or not, not-for-profit. And that's hard to believe when you look at the tuition, but it's not. They funnel all the money back into the university. 7th largest independent university, I didn't know that. The way Nova really got its name was distance education programs. That's what they went crazy with, and they are one of the leaders. You can get doctorates. I had people in my cohort from California. I had somebody from the I want to say Aruba, and I might have that wrong, Puerto Rico, I mean, all over. And we all communicate online. Classes are online. We do projects online. It's pretty cool. The way that you apply to Nova, you can go down. You can pick up a brochure. We have info sessions twice a year. One is coming up in May. My cohort, Ingrid Pichardo, who I think you might know. Okay, because she told me about this. Yeah, she is doing the next one. It's usually one of us. We're the only two that ever seem to volunteer. But they're a lot of fun. There is a website you can go on, and our brochure is actually on the web. So you can see everything that's there, what the minimum GPA is, what the courses are, what we're looking for, okay? We tried to make that easy. That's us. You can see us from I-4 if you used to have to look through the trees. Now they cut all the trees down. But Nova actually has 4 campuses for PA education. The main one's Fort Lauderdale. It's gorgeous, gorgeous. It's a beautiful campus like this one. Huge, beautiful. The first one then they developed was Fort Myers. Then came us, and Jacksonville is the newest one. Okay, we are all 2.5-year programs. Our didactic year varies a little bit. Okay, we're allowed to do that. So you would do 1.5 years of didactic instruction and then go out on supervised clinical rotations and preceptorships for your next year before you graduate. We keep an eye on you. My umbilical cord just gets longer, okay? But we hold on to you pretty tightly. So if you want to apply, there is this CASPA, Central Application Service for PAs, web-based. You apply, you put all your data in once, and then you can apply to multiple sites from there. And it's not as expensive as the $200 you may have to send here and $150. I don't remember the number exactly. I just stepped down as the admissions chair because it was just too much. But I know you can apply multiple PA schools. So when people come to interview for me, they're usually going to 5 or 6 or 7 or 8 other schools also, okay? CASPA will verify your coursework so that when I get your application, I know it's solid. They'll calculate your GPA. And again, you just put your data in once and it just keeps going out. So it makes your life a lot easier if you're interested in PA school, all right? Things you can do to improve your application. I cannot tell you enough. Exceed the required number of science hours. Our typical applicant has between 65 to 75 hours of science. And I'm not talking a 1,000 level, and I'm not talking the easy chemistries. I'm talking the tough stuff, okay? Some people like physics. They'll go that way. But we want chemistry. We want biomed. We want biologies, because that's what you need to treat patients. Physics helps you think in a different way, so you may be a little bit easier when it comes to picking up critical thinking skills, but we need all of that, okay? You want to work. I would suggest working. There is no minimum. When I went to Stony Brook, you had to have 1,000 hours of patient care. So does UF, but I think they boosted it up to 2,000. And that doesn't mean, being a hospital aide wheeling the gurneys. That means doing some sort of patient care. If you really want to do this, and I think it's one of the best professions in the whole wide world, make sure you know what you're doing. Get in there, see what it's like to take care of patients so that you really know what you're doing. You don't want to get in school and sit there and go, oh my, this is not for me. The education and stuff will help you. Your classmates will help you, but you got to really want it to make it through, okay? Job shadow PAs, very tough to do. You go on the Florida Academy website, and they usually have a list of people that you can job shadow. Gets tougher and tougher as PAs have to see more and more patients to make money, okay? But turn over every rock. If you're an applicant and you're sitting in front of me and I say, where's your job shadowing? And you say, oh, I couldn't get any. Yeah, you can. You got to work really hard. If you're not going to work that hard there, are you going to work hard enough in PA school? That's kind of what we see reflected, okay? Because I've got students that work in every area they can get. I don't care if you have a family friend that's a doctor. Pull them and then see if they can get their friends. Do whatever you have to do. Shadow, okay? And get your GPA as high as you can. Repeat courses if you need to. Get out of the C's. Make it a B or an A. We look very favorably among people that are willing to get a higher grade, and get your GRE as high as possible. Okay? Yeah.
Just wanted to ask that. So I found out that CASPA, let's say UCF has a grade forgiveness policy, so if you did bad in a class, you can retake the course and have the grade forgiven.
Right.
CASPA keeps the old grade as well. So still retake it, but don't be disappointed if your CASPA GPA is not as high as
Right. That's exactly. But what I do when you apply to me and my admissions person sends me your chart, because of course I prepare before you show up. I read everything in your chart, everything. And I see that you had a C+ in Chem 1 at a 2000 level. You're right, it doesn't get erased. But I look down, I see the next year you took it again and you got an A. In my head, you go up a couple of points because you had the wherewithal to do that, and I know I'm not going to see it in your hours, but I'm also going to see it in the science hours total. And you're going to be in that 60 to 70, and that's what I want to see, okay? So I'm telling you straight. Like I said, I was the director of admissions. Just stepped down 2 weeks ago. They're still begging me to take it back. And I just can't. I have other things I want to do, but I'm telling you as straightforward as I can. I'm a New Yorker. I don't pull punches. I tell you exactly the way it is. A lot of people don't like that, but you never know. You always know where you stand with me. I don't ever fool around. After you graduate, okay, you must sit for the PANCE. You must. That's your certifying examination. That gets you the -C, okay? It is a mark of professional excellence. There are a few PAs out there without that. They have a harder time finding jobs. They're not unemployable. But they have a harder time, okay? This test is given multiple times throughout the years at the various testing centers, the Sylvans and all of that, and it's offered through the NCCPA, which is our certifying commission, all right? The PANCE, as you can see, is 5 hours long, 300 questions, 5 blocks of 60 questions. You get 60 minutes. You can go straight through or you can take a break, whatever you want to do. Totally computerized. Once you pass PANCE, then you have to be licensed in the state where you're going to work. So in Florida, you go through the Board of Medicine, PA, okay? And they will tell you exactly what you need to do. And that's the part has changed for us now because You have to relicense every 10 years. You have to reboard every 10 years, okay? But within those 2 years, like I have to take a medical errors course every year. I have to take a domestic violence, like I can't remember, like every third time in a 6-year biennium. They have all these numbers, and it's all listed there, but you are responsible for keeping track. If you don't do it, you won't recertify, okay? The Board of Medicine in Florida does not mess around. They're nice people, but they don't mess around. So I would definitely pay attention. Here's our professional organizations. I talked about the AAPA. PAEA is really helpful for me because it's Physician Assistant Education Association. So they actually help me learn how to teach you guys, and they keep me up to date on teaching and stuff like that. APA, the American Academy of Physician Assistants, and FAPA, those are the two that I would pay my dues to without blinking an eye, because they do a lot for you, national level and state level, okay? And then we have multiple specialty organizations. If you're a PA of a specific ethnicity, I remember there was Native American PA Association. If you are family practice, there's PAs for family practice, and you can join those different areas if you so choose. But after graduation, I got to tell you, the sky's the limit. My students are going to be breaking ground. They're going to be doing things that I can't even conceive of right now. PAs are breaking big into radiology, into interventional radiology, which is really cool. If you've ever been in a cath lab, it's amazing what we do in there. There are no shortage of employment opportunities. My students get job offers in their clinical rotations, okay? Sometimes they get 3 and 4, and they have to decide where they want to work, okay? And many of our preceptors actually are preceptors because they're kind of vetting for PAs, okay? So don't forget that. You do have to do continuing education. It's not as bad as it sounds. We have to do 100 CMEs every 2 years. 1 CME is 1 hour of education. I can do it by reading articles. That process is changing now with this performance improvement, the PI CME, and the certified added qualification. So if I was a PA in cardiology and I wanted to bump my credentials up even higher, I could sit for one of these CAQs or come up with my own plan of action and get an extra added oomph to my name. So when you want to be employed, it really looks good, and you're a specialist. You're really more of a specialist. But then again, you must recertify. Instead of taking PANCE for your certifying exam, now you're going to take your recert exam, so it's the PANRE. I've sat for mine twice. I'm due for the next one in 4 years, I think, and then I'll be on the 10-year cycle. You just study. There's all kinds of review courses. It's not so bad. I keep going up 10 points every year. Most people go down, I keep going up. It's weird. But this is the father of the PA profession, Dr. Eugene Stead, and when he graduated the first 3 PA students from Duke University, they were former Navy corpsmen, so military is near and dear to my heart. My son is a Marine. He declared October 6th as National PA Day, and we celebrate it all week long. So he's our grandpa. We are only 40 years old, but we have made incredible strides, improvements, and I very much feel that that is due to the people whose backs I ride on. You know, they did, and now I'm going to keep doing and making it better. So, you know, if you're one of my students, I'm going to push you hard, without a doubt. You're going to learn how to critically think in my class, without a doubt. You won't escape that. But it is the best. I think it's one of the best ways to make a living. I absolutely love it. One of the things that we're doing now is offering a concurrent degree, PA and a master's in public health. So once you get through the first 12 months of didactic, then you can start taking some of these public health courses so that you can, in time, get a public health degree. Some schools are offering this in education, some in business. That's what I'm saying. PAs are going to start going into areas that I don't even have an idea about yet. If I was to get my MPH, I could probably manage a nursing home with a supervising physician, okay? The sky's the limit, okay? Teaching, if I wanted to go into business and open my own business, one of my really good friends is up in the Villages. He's a vascular PA. He's brilliant. He's absolutely brilliant. He does veins. In the Villages, you know how much, he's like, I'm not saying do it for the money, but he never has a shortage, and he's brilliant. Who would have thought? He basically has his own practice, and he hired an MD on as a supervising physician. So you can do lots of things, okay? He's just naturally brilliant, so he didn't need the business degree. He has a business partner that figured it out, but there's just so many things that you can do. So this is our first class The class of 2012, they're not our first class, but they were our first class to get 100% pass rate on the boards. And we have a 3-year history of that. So we're very proud of that. We are the only NOVA program that has 100% pass rate, and we did it for 3 years in a row. This is us. This is the faculty at the ICE show. This is the class now. We all wore red, okay? I'm around here somewhere. I don't know where the heck I am. But in the white coat. The white coat is what you're really aiming for in life. So, any questions about this? Did I talk too long, too fast? Yeah, I mean, I can't either. I have like a mental 15 minutes in my head, you know.